Should you get genetic testing for stroke prevention? Imagine knowing your risk for stroke before any symptoms appear. Genetic testing can help identify if you carry certain DNA changes that might increase your chances of having a stroke later in life. If you have a family history of stroke or related heart problems, this testing might be especially useful. It involves analyzing your DNA to find genetic variants that could make your blood vessels or blood more prone to issues. Research shows that genetics play a role in stroke risk. Some gene changes affect how blood vessels work or how your blood clots. For example, variants in genes like GUSA1A3 and JASAH1 influence blood vessel health and platelet activity, which can impact stroke risk. Variations on chromosome 9p21 are also linked to atherosclerosis, the buildup of plaque in arteries, which is a major cause of stroke. These genetic factors can help explain why some people have strokes even if they don't have traditional risk factors like high blood pressure or smoking. Getting genetic testing can offer several benefits. It can help identify high-risk individuals early, even before any symptoms show up. This allows for earlier lifestyle changes or medical interventions that could lower your risk. It can also give a more personalized picture of your risk, helping your healthcare provider tailor prevention strategies just for you. For example, if genetic testing shows you might not respond well to certain medications like clopidogrel, your doctor can choose an alternative to better prevent a stroke. Genetic testing can also be useful for your family. If you find out you have certain genetic risks, your relatives can consider testing too. This way, everyone can take steps to reduce their chances of having a stroke. However, it's important to remember that stroke is a complex condition. Many factors, both genetic and environmental, influence your risk. Genetic testing doesn't predict with certainty whether you will have a stroke, but it adds valuable information. The effects of individual genetic variants are often modest, and current risk scores are still being improved, especially for diverse populations. It's also crucial to see genetic testing as part of a broader approach that includes managing blood pressure, cholesterol, diabetes, and lifestyle habits. Interpreting genetic test results can be complicated. That's why talking with healthcare professionals or genetic counselors is essential. They can help you understand what your results mean and how to use that information effectively. Ethical and privacy considerations are also important, so discussing these with your provider can help you make an informed decision. In summary, genetic testing for stroke prevention can be a helpful tool, especially if you have a family history or early signs of cardiovascular issues. It can improve risk assessment and guide personalized prevention plans. But it's not a replacement for traditional risk management. Always consult with your healthcare provider to see if genetic testing fits your individual situation and how to best incorporate the results into your overall health plan.